Dear colleagues, my name is Ekaterina Mironova. I am PhD, head of the Laboratory of Molecular Biology of the Cell, St. Petersburg Institute of Bioregulation and Gerontology, and also head of the Laboratory of Molecular Neuroimmunoendocrinology, St. Petersburg Research Institute of Pulmonology. Today we will discuss the rationale for the effectiveness of using peptide to regulate thyroid function. The thyroid gland is an endocrine gland located on the anterior surface of the neck, constituted of two lobes and in isthmus. The thyroid gland secretes the iodinated hormones T4 and T3, as well as a non-iodinated hormone calcitonin. The main components necessary for the formation of thyroid hormones are iodine and the amino acid tyrosine. The synthesis of secretion of thyroid hormones is regulated by the hypothalamic pituitary axis. The hypothalamus secretes TRH, which stimulates the pituitary gland to secrete thyroid stimulating hormone TCH, which in turn regulates the growth and function of thyroid gland. Thyroid hormones T3 and T4 influence all types of metabolism: water, electrolyte, protein, fat, carbohydrate, and energy. Adequate levels of thyroid hormones are essential for the functioning of the central nervous system. Calcitonin is involved in calcium metabolism, preventing its leaching from bone tissue and thereby reducing its concentration in the blood. Cases of thyroid disease: impaired hormone synthesis due to low or excessive iodine intake, etc. Changes in the functional state of the central nervous system, and tissue resistance to thyroid hormones. Thyroid pathology is one of the most common diseases. Age is a major risk factor for the development of hypothyroid conditions, along with biogeochemical and climatic extremes in the environment. Hormonal imbalances affect the quality of patients' life with hypothyroidism and require the development of adequate correction methods. In this regard, special attention should be paid to the peptide bioregulator Sergeevna, which has a tissue-specific effect on thyroid cells and helps restore impaired thyroid function. Sergeevna addition to the organotypic culture of the old rat's thyroid gland contributed to an increase in the area index and thyroid tissue proliferation. Sergeevna increased the cell proliferation marker PCNA expression in old rat organotypic thyroid culture. Sergeevna increased the area index and the cell proliferation marker PCNA expression in organotypic thyroid cultures from old rats. Furthermore, Sergeevna reduced apoptosis in thyroid cells from old rats to reducing the expression of the P53 marker. Sergeevna has a pronounced normalizing effect on thyroid function in patients with subclinical hypothyroidism. A course of treatment with the medicine leads to TSH level stabilization and decreased thyroid function clinical symptoms improvement. The Sergeevna application also improved the clinical manifestation of primary hypothyroidism in 78% of cases, with the greatest effect observed in older individuals with pronounced sign of thyroid atrophy. While taking Sergeevna, patients reported increased performance and a reduction in the frequency and intensity of headaches and heart pain. The thyrogen effect on the thyroid parenchyma morphological structure was studied in a presence of various origins organic changes. Ultrasound examination demonstrated that the greatest efficacy of application was noted in patients with adenomatous nodules in 70 cases of 20. In second place, in terms of the number of cases with an improvement in the gland morphological structure, are degeneration 40. This is 53%, followed by cysts, this is 50%, and chronic inflammation is 44%. On the pictures above, you can see three pictures where take place a nodule, a big size nodule, but after 4.5 months after application Sergeevna, you can see that noodle disappeared. The best results with Sergeevna were obtained in patients aged 40 to 60 years. This age distribution suggests that the less pronounced treatment efficacy in younger individuals is due to a sufficient reserve of the body's own regulatory peptides. In older patients, the lower treatment efficacy is explained by significantly reduced levels of endogenous peptides, and the administered thyrogen dose was insufficient to replenish them. Thus, the obtained results of the medicine thyrogen study indicate the effectiveness and feasibility of using the medicine in complex treatment and prevention of various origins thyroid dysfunction. Thank you for your attention.